All righty, I'll go ahead and get started. And first of all, I'd like to thank everyone who's taken time out of their day to join us for this webinar. It's a little bit of a different webinar for us today. What we're going to be covering is basically the entire application of Caretracker at a very, very quick and light pace, where we're going to talk not about how to do extensive training on any one particular module or function, but rather what we're going to be doing is trying to share with you the things that we've learned working with Caretracker all these years that have saved us time or grief or gotten us out of a jam or helped us to avoid a jam here or there. And so today's presentation is called Caretracker Tips and Tricks. And we've got Cheryl scheduled to deliver content. And most of you probably know Cheryl from your support calls, whether you know her through a to-do or email or picking up the phone and calling her. We want you to know that everyone here at Phasis is more than happy to help you. And these little tips and tricks, you may forget what those are. You may see something in there that you liked. Just pick up the phone and give us a shout. We're going to email this presentation out, at least the slide portion of it, and that might be something that you could remember, the little tip that you wanted to pass on. We also will have this session recorded, and it will be on the Phasis group website. So let me kind of talk you through essentially what today's presentation is going to be. Cheryl is going to start us off with, and let me get in here. Cheryl's going to start us off with navigation and general information, work her way through the dashboard, and then each one of the Caretracker modules. We didn't do report manager, and it's possible we've left something off, but we're just trying to kind of hit briefly all of the different areas and give you some pointers that might help out a little bit. Lastly, we're going to talk just very briefly at the end of the presentation about some regulatory requirements that are coming down from CMS. We wanted to make sure everybody was aware of those. And a reminder again for everybody on the call, please mute your phones so that if you have a side conversation that goes on, or you're probably doing a little bit of work while you're watching this, we won't hear the paper shuffling and that type of thing. So real quick, on the navigation in general, Cheryl's going to show you, kind of remind you about some of the simple things that we do every day, like creating a batch. But I have a feeling there's pieces of that we've forgotten how important it is, that getting your settings in your batch will translate to the rest of your experience in Caretracker, specifically defaults, where you go, how fast it acts, all of that type of thing. I also wanted to point out, when you do get your presentation, you're going to notice that what we've done on most of the pages is just making a snapshot, if you will, of the help menu. And the help menu is organized in a kind of a book contents, and this is down the side, and these kind of reflect the modules. But this is just a reminder that you're able to use help with just a click, and if you know where you are in the program, you can fairly quickly get to that area, or you can use search. But help is a great way to refresh your memory on some of these little items. So after Cheryl goes through navigation in general, she'll spend a little bit of time on the dashboard with just some of the links that maybe people have forgotten about. A lot of times the dashboard is the only entry into a specific module. For example, collections, if you don't go through the dashboard, you can't get to it. Then Cheryl's going to go through each of the modules in Caretracker, spending some time on the patient module, talking about how to manage the patient record and how to navigate in there to do things as fast and as least amount of clicks as possible. We're going to spend just a little bit of time on the scheduling module. There may be some things that people have forgotten that Caretracker has a capability of. And again, I want to tell everybody, just if you have a question and Cheryl's going through this, either put your question in the chat or unmute your phone and pipe up. We don't care how the webinar goes. We want it to you guys to get the most out of it as possible. Cheryl will continue going down the transactions module. Now this gets into charge entry. It also is where you can do payment posting and a bunch of things you can work from there. Financial module, which is a place where you can obtain copies of statements, look at the patient claims that are open. You can also view correspondence that would be in there. And there's a lot of little tips like how to sort the fields or how to change the filters that are going to help. Then Brad will take over for about 10 minutes, and he's going to talk through clinical today. Again, probably a lot of these things that you're going to see, you're going to go, yeah, I know it. Hopefully, we're going to trigger a few memories that people have of, oh, yeah, I wanted to see if there's an easier way to do that. Brad will take us through clinical today and then inside of medical records. And believe me, we could go on for days inside of medical records, but we're going to try and limit it to just the quick little things that are going to help you the most. Bruce will then take on document management. I'll spend a little bit of time on reports. Again, this is not training. This is just trying to give you a few key pointers. And then Bruce will finish up with a few short things related to administration, and then we'll try to bring the entire program home. So Cheryl, would you like to unmute and say hello, and we'll make you the presenter, and we can go ahead and get started. We're going to start with the navigation in general.
Good morning, everyone. All right, I'm going to share my screen now. Make sure we're saying, okay, so the first thing we want to do is make sure that everyone knows with login, when you first come to your Caretracker page, your default is for current, but just make sure that you're also aware that we can log into rapid release from this screen also. A lot of times new functionality will be deployed in rapid release, and it gives you a chance to log in there and kind of check it out and make sure that you've tested it and everything works like it should before it's fully deployed. Just go ahead and log in here. Another feature that I want to make sure everybody is aware of is the view.caretracker.com. This is a new, not really new, but a website that if Caretracker is experiencing any problems or anything like that, you can log in to the view only. It doesn't allow you to really do a lot of, you can't enter your billing and you can't chart in there, but you can look at your schedules, you can look at chart summaries, things like that. So it is kind of a view only. And to get there, you would go to view, or the HTTPS view.caretracker.com. And it'll take you to this screen. Just use your regular username and password, and it'll take you into that one.
And I might mention that Caretracker's got a huge initiative now where they're actually moving the data center and changing the server configuration, and all of that is in response to resolving the downtime issues that we've had on and off this year. Some of the downtime is actually related to the work that's being done, but we haven't had, knock on wood, downtime recently. But if you do, and you're stuck and you didn't print the schedule or print the chart, view.caretracker.com is a great place to go to let you help, not be stuck in the water, so to speak. Go ahead, Cheryl. Sorry. And it looks like
okay.
Bruce is asking us to
try dragging the right side of the window to make it. Oh, okay.
Whenever we change presenters, it could get smaller. You can drag the right side to enlarge it. That's all.
Thanks, Bruce. Okay, so the first thing I wanted to go over is going to be the name bar, and that's this top toolbar up here. With a patient in context, maybe a lot of you live in the schedule, for example. You can have access to a lot of information up here without having to leave your home schedule. So you can add a new patient very easily right here. You do what you need to do. You save it, close it, go on, and you've not lost your place. Editing will edit a patient in context. I'm going to spend a little bit more time on that info button, so we'll come back to it. But you've got a lot of other buttons up here that are pop-up buttons. And I love the pop-ups because then I can be in the middle of doing something, look at what I need to look at, and I'm not going to lose my place where I am. I know in the past we've kind of maybe told you it was okay to use multiple browser sessions, but we have found that if you're working on 2 different patients in multiple browsers, sometimes that can cause issues. So we're going to say kind of using multiple browsers with different patients is a no-no. Back to this. The other one we have up here, I'm sorry, is the batch. And we did talk a little bit about the batch. So what I'm going to do is just kind of go over some of this to show you a little more detail. Any of you that are familiar with billing know that you have to have a batch open every day to capture any financial information if you're posting payments or charges, things like that. So that's these first fields up here at the top. Those have to do with that financial. What batch is that going to go into? But a lot of you aren't familiar with the center section, which can set defaults. So, for example, I have Dr. Pinto as my provider. So if I'm going to access any area of Caretracker that has a provider, such as I pop open to write a prescription or something like that, it's automatically going to drop Dr. Pinto in there for me. So if you work specifically for just one provider, that can save you some time clicking and bringing it in. Resources. The resources are the columns that are on your schedules. So if you have it at select, you're going to see everybody on the schedule, but sometimes if you want to just pull in one particular doctor's schedule, by doing it there, that'll only show you that one. And then the same thing with location. A lot of questions that I get sometimes might be when you're on the schedule, you only see, like, where's my schedule? Because that location up there in your batch has defaulted to something wonky. So these are really important to know what each of them mean. All groups default. Most of you one group in your parent company, but we have a couple of you that have some multiple groups. If you change this one to yes, then you're going to be able to see all the transactions across all the groups instead of just the group that you're in. Show alerts is another important one to say yes, and that's if you've added any of those notes into patient demographics and click that flash box saying yes to this will allow you to see those pop-up notes. The dates over here, those are going to always default to today's date, and that again goes back a little bit more to billing. But if you leave them blank, it defaults to today's date. Sometimes though, if we're working in a different month than the current month is, we want to change those dates to match what fiscal period we've chosen. So for example, if we chose April and we're still working in April, these dates have to be an April date or it's going to confuse it. It doesn't like it if you're going to try to cross over. Then down below we have what we call redirects, and this kind of tells the system where am I going to go when you're finished. So for example, if I'm putting in an encounter and I click save, where is it going to go next? It's going to go to a new encounter. For the scheduling, if I book an appointment, it's going to go back to that appointment book list. So you might want to think about some of those, like where do you like to go? If it's taking you somewhere and you have to close out of there and go to a different screen every time, think about how these redirects might make it easier for you. The same thing with the login and the home. A lot of times we'll tell clinical people to make their login go straight to clinical, and that goes to clinical today instead of the home dashboard, which is where they live. So keep that in mind too. If you log in and you always come to the home dashboard and you immediately go somewhere else, you can change that login application to take you where you live the most. Okay, the other one that's really helpful, one of my favorite buttons up here, is our info button. This one can give you patient and context so much information with just a pop-up here. So we first can see some basic demographic information, address, phone numbers. It's a quick and easy way to get a phone number. We also can go through everything that we can do demographic screen almost. You know, did we hold statements? You can't edit it from here, so it's just a view though. So it's a quick way to look at it. You know, what is their employer, who is their insurance, etc. We have documents here, so all the practice management documents show up in a nice little list, which I know Bruce is going to talk a little bit about the document management. I like this because I can see them very easily here and I can find them easy here. You can also see patient balance. Is it due from the patient? Is it due from insurance? And how old is it? So it might be a quick way for you to say, oh my God, this guy is over 120 days old, or maybe it's current. So same thing here, you know, would just pop through these referrals, cases, but another one I like under documents, if you go to the correspondence, you can quickly see all the correspondence that is on this patient's account. So it's a quick way for you to just pop this open, see that stuff without having to spend lots of clicks going out to another area of the program and then clicking back into where you were. The last one I have on this navigation one is this links button. This one is really kind of nice. If you have added some links, which we can tell you how to do that if you'd like to, and what it does, it will take you to other websites. So if you're always going to the Encoder Pro, if you're a biller or you have an outside website that you refer to a lot, by adding a link within Caretracker, a simple click here, it shows it in a pop-up and it will take you to that new website. So it's really kind of nice if you're finding yourself going to a lot of outside websites. Do you have any questions so far before I move on?
Doing great.
Okay.
A couple of things I had forgotten about, so thank you. It's going well.
All right, so the next thing we've got is kind of the dashboard. This is our home dashboard. Now keep in mind most of these numbers that you're going to see on the dashboard are overnight refresh. So for example, if I see I have this 230 inactive claims and I go in there today and I wipe out 100 of them, this number here will not refresh until tomorrow morning. So some of the billing functions and the claims functions are going to depend on did you close your batch, because as all billers know, nothing is final until that batch is closed. So keep that in mind. If you worked on something and then the next day you come in and it didn't change, that's the first thing I would ask is, did you close your batch? So keep that in mind, you know, appointments, all of these, and I'm not going to go into a lot of them because I think most of you are pretty familiar with what they do. But if you want more help on any of them, please, you know, let me know if there's something on here that you want me to cover a little more extensively. One of the ones that I get a lot of questions about, or I guess there are two of them, are these unbilled patient procedures and unbilled insurance procedures. They're pretty similar, and they're kind of what they say. If we click into this one, it's going to show us any patient balance that is older than 30 days and the patient has not gotten a statement for it. So sometimes you'll then see numbers that you can drill further down. You can actually look at it by financial class, or you can click on the total. Some of the ones we might see in here are going to be maybe got your system set that I don't want to send the patient a statement under $5. So you might see a little $1, $2. It's a nice way for you to look at these. If that patient is never coming back, you might then want to look at, what do I want to do? Do I want to force it to generate a statement for that small amount? Do I just want to write it off? But it just kind of keeps you aware of those open balances that are on. And then the insurance is kind of the same thing, but it's going to go anything older than 5 days because we generate claims a lot faster than we generate patient statements. So if we have any balance due to the insurance and it hasn't generated a claim within 5 days, it's going to show up in here. In here, a lot of what you're going to see, oh look, we don't have any, but a lot of what you might see in here is crossovers from Medicare. You know, Medicare says we've already sent that over to Anthem, so you didn't generate a claim for it, so it's still going to be there. You want to look at these periodically though, because maybe, you know, it's gotten to be like 2 months old. Obviously, you maybe want to manually generate a claim for it, or you just want to be aware of what's in there so that you have a little bit better handle on what's going on. The statements, I'm going to skip to the statements first. If you have Caretracker doing your statements for you, you have this little link about bad and forwarding addresses. So Caretracker uses an outside service called ExpressBill to send out those statements. If they get a bad address or something that's not deliverable, it's going to come back in here onto your dashboard. So you do have undeliverable addresses and you have forwarded addresses. And Matt, do you mind if I use the care group on this one just to show a little bit what it's about?
Yep, that'd be fine.
Since we don't really have any in there. We may not in here either, though, but...
There shouldn't be. There might be one or two. We do try to clear those out.
That's okay.
So my apologies. I guess I should have been a little more prepared with having one that had some in there. Yeah. But you want to kind of keep that in mind, that if you see a number here, you want to click in there. It's a nice way to work those forwarded addresses. It'll tell you, here's the address that it had on the statement. Here's the new address that the post office is forwarding it to. And you have some little action buttons there to upgrade the demographics immediately, generate a new statement that would go out to the new address, those kind of things. So peek in there on your own and kind of play with it and let us know then if you have any further questions.
It's one of those items that is designed to help you not have to rekey a bunch of information. So if you did send out a statement using the electronic statement service and one of your patients who's getting a statement had moved and they put a forwarding order at the post office, if you had written that letter out by hand and typed up or handwritten the envelope and stuck it in the mail, that would be the one where the post office would put the yellow sticker on it and it would get forwarded. However, we never know that yellow sticker got put on there when it's a paper statement. The electronic statement, what happens is the statement goes out. Rather than getting printed first, it goes through the USPS database. The system recognizes that there is a forwarding order on file, and rather than printing a statement with the bad address that has to get forwarded with a yellow sticker, the statement actually is printed with the new forwarded address. And inside a Caretracker, you're notified and given the opportunity to update demographics with it. And it's one of those things you're given the opportunity because sometimes a forwarding order might be seasonal. If a snowbird spending the winter in Arizona or Florida or something like that. So it's just a nice little feature that some of you may not be aware of. That's time savings. Thanks, Cheryl.
Okay, so claims work list is the next one we have on our list, and I think anybody that does billing is probably familiar with this, but maybe some of you are not. We have our different columns here that we could look at new and prepared, claim edits or any of those that bump up against the claims manager edits. Payer edits are rejections that come back from the payer. Inactive, this is probably one of my favorite things about billing in Caretracker, is if a claim is more than 30 days with no activity on it. It means you haven't rebilled it, you haven't put a note, anything like that, it's going to fall in your inactive bucket. So you're not maybe continuing to look at the same claim that you called the insurance about 3 days ago. These are just the ones that really do need your attention. So I kind of like that. They're broken down then by financial class. So you can click in and just look at the few that are in that financial class, look at all of the ones that are at the bottom there. And then once you click in there, it's real easy. It makes it friendly to be able to see what's wrong with it, use your toolbar up at the top to correct anything that might be wrong, and then rebilling the claim. We'll come back to that a little bit more when we get to the transactions to show you maybe how to do some other things in there. Okay, does anybody have anything else on the dashboard that they might have a question about or need more information? Can you please go over the task color key? And Aaron, I'm sorry, I'm not quite sure what it is you're referring to.
So I think, are we talking about it in the work list, the red, yellow, and white?
Oh, okay. Yeah. Sorry, I didn't quite understand. Okay, so let's go in here. So the red, and if you look up here, the red tells you that this claim is reached its timely filing limit. So sometimes you might want to pay attention to those first. The yellow is that it's about to reach that limit. And let me see if we have any in the yellow here. We don't. And then if there's no outline at all, that's just a regular claim. Okay, so no outline, it's within its limits. The red is it's reached its timely limit, and then yellow is you're very close and you need to pay attention to that one. Did that answer your question?
Might have someone else said back in the schedule. There's also a task key when we were kind of looking at.
Yeah, that's the one I meant. I'm sorry.
Oh, I'm sorry. Okay. So we will be getting to the schedule, and that I will put that down and come back to it if that's okay with you, Erin.
Great. Thank you. Okay.
Okay. Just quickly, we'll go through the patient module. I don't know. I think most of you are now using the new enhanced demographics. There might be a couple of you that are still using the old ones, but it took some getting used to find out where everything had moved. But everything that you're used to having is still there. The summary button over here is a quick and easy way to look at, and I don't really want to print that, but to look at all the details for this patient. So I think in the old it used to have a tab, but now it's just got this little print thing. You might want to print this if you are sending the patient maybe to an outside facility, or you're sending an x-ray order or something like that. This is good information to be able to send over there with it. Scanned documents is another one. So, a while ago we were scanning things as PDFs, and now they're not, if they're pictures, they're not going to show up here. You do still have, and I don't know if this guy's got any on him. Let's go back to our patient here. Okay, so we see Betsy's picture here because it was scanned as a PNG. So if we have a PNG file or a JPEG file, we'll actually be able to see that picture. But maybe we scanned those in using a PDF file and we won't always be able to see them there. Insurance cards should still show up down here with your little attach that you can click into and see them. This one doesn't have any on there, but you also can go again to our handy info button. If you did scan that as a PDF, again, that info button over to your documents, and you can see all the documents there that have been scanned in. Pretty easy and simple. You do still have the documents in their own little tab here, and Bruce is going to go over some of this also. But you'll see here now it tells me I don't have any matching documents because of the filters that are up here, where clicking that little info button will immediately show me all of them without having to fight with all those filters. You also can deactivate, so show inactive if you've got if you have inactivated documents, that will take it off your list. Let's see, I don't know if we can open one that, and maybe I'll let Bruce show you how to inactivate it. But if you've got inactive documents, you can click the show and it will come back up there for you. The correspondence, I like that they've added this now to the demographics. We also have remember our correspondence up here on the documents, so if you want to use it as a pop-up on our info button. But this will list any correspondence that's been connected to this patient. So you're going to have, you printed a chart summary, if there were to-dos, you've entered any phone notes or billing notes in there, and also any letters that you might have printed for the patient, not only clinical, but maybe you sending collection letters, things like that. All that will show up here. You can print the correspondence log if you're using this. Let me open that here. It doesn't include everything though, so be aware that sometimes what you see here is not what you're going to get when you print this out. So be aware of that. Also, you can reprint some of these stuff, and when you see the little doctor with his pencil there, that in the ones that are highlighted kind of tell us that we can reprint that. And you'll see these down here are grayed out, so that's not allowed to reprint those. Usually the only things that we can reprint from this list are going to be letters. To-dos also, if you see the to-do here, it always includes the to-do number, and maybe it doesn't show, because you only get a brief description, but by clicking on the to-do, it will open the whole thing, and you'll be able to see all of the activity that went on with that to-do, or if the full description if it's been shortened there. Okay, any questions so far there? I'm going to move on then, try to keep on task. Hopefully I'm not taking too much time, Matt.
You're doing fine. It is 11:30, so another 2 minutes to get through the rest of it would be perfect.
Okay, so again, keep in mind when you first come into your schedule that we have these filters up here. And if we had in our batch to say hospital, and we come in here and it's just showing hospital, and you're going to be, oh my God, where's my schedule? Make sure that you're looking at those filters first. And those filters are controlled by this center section here, those defaults in your batch. So the task colors, we have our key up here. There are global tasks that are in there, and if you hover over it, you can see this light blue color is anything. This green is a new patient. The dark green is an EMG. So the key up here will kind of tell you what those colors mean. You can do, and whenever you see the G, those are the global tasks that were there, but if you don't see a G on there, that means that those maybe are some that are customized. Now keep in mind the colors that show here are only until a patient has been scheduled, and once you put a patient on there, it goes to white. But it's a good way to keep track of what kind of appointments I want in that time slot. We do have the outline of color. Let's say if you want all of your new patients to show up, my doc only wants 3 new patients on there for the day, we can put color outline, like these 3 are in red. So there are colors for the outline to kind of tell you how to make those pop out. Putting the colors in your schedule, that is controlled by building the schedule. Somebody's asking. And so one quick one I want to show you too, if you are building your schedule and you're on the day, you can go, obviously we can go to administration, setup, build schedule, lots of clicks. But if we just come up here to the top of this column and click on it, it automatically takes us right there to that build schedule. So it's kind of a nice little, saves us a few clicks. So when you were asking how you get the colors, let's say in your fill slots, you've determined a task here. You've said from 9 to 10, I only want the CPE. The task class is set at CPE, and if we go back and look at that, it will have a specific color assigned for it. Does that make sense? Building schedules can take up a lot of time, so I don't want to get too far in, but Dasha, if you want more, please reach out to me separately and we can go over that a lot more detail.
Yep,
okay?
in the admin, under scheduling appointment types, that's where you would go to actually assign a color to it, or is it or I can't remember, Cheryl, it's either there or tasks, but nonetheless, it's in the admin portion of building your schedule as you have the opportunity to pick for a specific appointment type, what type of color you're going to have.
Right. So if you'll see how easy that was, we went in here, we did our build schedule, we're finished, then we just click back on this book, takes us back to our schedule. So that's kind of a little shortcut rather than having to click in and out of several modules. The other thing that I have questions about a lot are the order that these columns go in. So when you enter a new resource, and remember these are our resources, they're going to put them on the schedule in alphabetical order. Now we've kind of found a little workaround by putting like an A done or A nurse or whatever your providers are. If you want to rearrange the order that you see these in, that can be done. Duplicate columns, sometimes you might see duplicate columns, and that's because you've got an availability overlap. So when you're building your schedule, if you have 2 times, and let's just go back in there really quickly. Whoops, wrong one. So if you've told it here from 9 to 10 I have this, and then you go down here and say from 9 to 10 I have something else, you've now given it 2 time slots from 9 to 10. And so what it will do is it then will give you 2 columns for 9 to 10. Some of you have taken advantage of that because you like having 2 columns to like double book instead of double booking in one. You like having 2 columns so that you might have a little bit better control over where they're double booked. But sometimes you don't want that, and that might be why. So go and check how that is set up and make sure there isn't any overlapping there. The other thing that we can do is when we're making changes to the schedule, if we go in and we create some new time frames or we change up a day, what you need to do is you have to take out the current schedule template and then put in the new one. Now, what I have found that this modify macro doesn't really work real well. So what I normally do is I go in here, I delete this here, and then I can do the scheduling macro to put it back in. And then here I would just say, I'm going to put this back, and it's going to be normal every week. Whoop, there was something already had one in there. We'll do this one. Improvement. It'll tell you if you do something wrong. Trust me. Okay, so keep that in mind. That modify macro, it just doesn't work real well for me that I found. It's just much easier to delete it and then put it back in. Once in a while, you guys might see a blinking red light up here, and that normally tells you have some kind of conflict. Sometimes if you've got multiple days out or multiple providers on your schedule, if you've got multiple days, it might blink the entire week for you. So to find out which day has the issue, you might have to do them one day at a time until you find out which one is causing that red blinking light. This column is the conflict column, so if you have an appointment that's not going to fit in there, sometimes it will throw it over here in this conflict column, and that's what that red blinking light is telling you, that there's a conflict on the schedule and that patient didn't fit in where they thought it should go or where you thought it might be. History, another nice way is we have our patient in context. We can look up the history of their appointments, but not only do we just see this list, we can actually click into that and do some things here. We can see who did what with this appointment, all that kind of stuff. So keep aware that you can click in there and do some navigating in there. Quick and easy way to reschedule an appointment, and this might be old for some of you, so I'm sorry, bear with me, but I know a lot of people are going in and kind of using a lot of the advanced button and stuff like that, but it can be so easy to pull in our patient. So we're going to pull Goofy in, and let's say Goofy decided he wanted to come in the afternoon, and so we're going to move him all the way down here to 3 o'clock. We have him in context. We're going to click on the time slot that we want to move it to. We'll see that he's already got that appointment. We're going to say reschedule and go. Oh, it already had an encounter. It's not going to let me reschedule Goofy. So that is one thing to keep in mind also. Once those patients have billing connected to them or chart notes connected to them, you can't then reschedule them. I'll just do this one really quickly. So we'll do Betsy. So now we have Betsy, and we're saying, oh, she doesn't want to be there. She wants to come in down here. We see the view, reschedule, go. It'll give you all the details, so if you need to add an additional note or anything, and you do have to have a reason why you're moving it, and then it will automatically just move her from one spot to the other. So remember, click on the spot you want to move it to, choose reschedule from that little drop down, and then it'll move it there. The mini menu, I know this goes by really quickly here. There are a lot of useful things on this little mini menu. Pull, for example, can pull it in. You're probably all familiar with confirming that appointment. I don't usually like to use that patient demographic because what it does is it just kind of bumps you all the way back to the demographics and it takes you out of your schedule. What is a little bit easier is just using the edit button up here to edit their demographics. You can view the appointment, obviously look at all those fun things there. check them in, transfer, check out. Double book is another one that you don't really need to use the advanced tab. It's really easy to use your mini menu. Say double book. We're going to book this appointment real quickly here. And it will put them side by side. So it's an easy way to double book using that little mini menu. Wait list is another one you can do from here. You can look at an encounter form. You can enter visit information. I know a lot of you are doing that already from your schedule. The patient edit pop-up is the same thing you're going to get if you go up here. And then payments. So a lot of you are using this to do their copays. So you come in here, you put their amount in, you leave force unapplied, that moves it over to unapplied, waiting for the biller to come in and put the charge in. But maybe you're going to do a payment on account. You can change this to say oldest to newest and save it, and then it will go on any open balances that patient has and apply them there first instead of just sending it straight to unapplied. Any more questions on the schedule? Did I get everything covered there?
Looks good. Yep.
Okay, then one last thing we have is this admissions. Where is admissions? Admissions. This is used if your provider's doing a lot of hospital stuff. Maybe they do inpatient visits or admission into the hospital, and those patients are not on your schedule. So this is a nice way to kind of keep track of who's over there in the hospital. Did the doc bill for all those days that he went and saw them? And it's a nice way to manage it without, for those that are not on your schedule. Try to go through now. We're going to move on to transactions real quickly. The top half of this, I think most of you are familiar with, the location, etc. These little plus signs can help let you add something on the fly. So maybe you see this needs an authorization number and you've got an authorization but they didn't put it in or it's not connecting. You can click on that plus button and add that auth number right here, save it, and it'll pull it in to be on that claim. Same thing with the case. If you need to add a new case with accident details or something, you can do that on the fly anywhere you see these little plus signs. Down here at the bottom of our charge entry screen, a lot of people kind of forget that. The check on apply and applied is defaulted to be checked, but sometimes you might have a patient that's maybe prepaid or something like that, and you don't want to pull that unapplied money. You can uncheck it here. You also can apply a payment from here. If you've gotten the charge in, you can then enter a payment amount, process a credit card, etc. It'll show you here if you had any unapplied money, what was applied to today's visit, and if there's anything left remaining in unapplied. It also tells you where am I going to go next. Once I hit save, where's it going to take you? And remember, this was one of those batch features that we can tell it, I don't want you to go to a new screen. I want you to go somewhere else. Okay. The other thing is this apply one visit. If you have a referral in there in the system and you have put a number of visits in your referral screen, when you enter these charges, this will automatically default to say, I'm going to take away one of those visits with today's charges. So it will tick down the remaining visits that you have, and it will also show you how many are remaining. So that's a really nice way if you're managing referrals and you know I only have 3 visits on this referral, you can kind of manage them that way, and it will automatically default. So you want to kind of watch and make sure that you do want to take one visit away from that referral. The other thing now, back to our bulk charges. So most of you, I think, use the visits, and then the biller, you're going to come along and do your charges. Couple of ways we do these. The first one is transactions, bulk charges. When you come in this way, you have to choose a specific appointment date. Today's is the transaction date is going to always default to today's date, but this appointment date, maybe we're going to look at yesterday's charges. You can order them by the appointment type or by the patient name, and you can control how many of these you see on your screen at one time. Then when you hit go, we don't have any there. Let's see, I know we had a couple on today, didn't we? Or did we change them all? And then you'll see the list of them that you're used to seeing. One of the other ways that you can do this is from your home dashboard. If you come over here under missing encounters, this allows you to use a little bit more filter. So instead of just being stuck by one particular appointment date, you could leave it open-ended. So maybe the doctor had a charge from last week that he never put in, and he just did it yesterday. So when you leave it open-ended, the beginning date through yesterday's date is where it defaults. Then you're going to capture all of those that have been out there. You can sort it by provider. You know, maybe today I only want to do Dr. Dunn's. And you can also sort it by location. So I only want to do the nursing home visits at first. Visits, yes, means that the visit information has been entered. I like to think of the visit almost as the super bill. The doc has done his part in putting those visit information in. Charges, no, they have not yet been turned into a charge. We don't have anything in here. Sorry, we should have left one. And then you'll see them just like you're used to seeing them.
That's just not a problem. I think the takeaway there, guys, is training will push you to bulk charges, but missing charges is actually a way to kind of, with a few less clicks, take care of the bulk charges.
Yeah, and you do have a few more filters here that you can use if that is easier for you to work. Another one on the dashboard that is denials. So when you want to work denials, now you will eventually get an EOB, but maybe in here you can kind of see some trends of things that, you know, let's say TRICARE is denying a lot of claims for the same reason. So you'll see the count of how many have been denied for which reason. Right here it gives you kind of the reason of the denial, but if you click into that, you actually will see the patient, detail, data service, etc. And then from there you can, oops, get that out of my way. Then you can go and open the claim summary and kind of take a look at what the claim summary does. From here you can rebill it, you know, whatever it is that you might need to do to correct that and get paid for it. It's a way for you to look at those denials a little quicker instead of waiting to get the EOBs in the mail. ERAs is another one. I don't know if all of you are familiar with the plus sign up here when you're doing your electronic remits, and that you can sort these. So you can look at closed ones, you can search them by insurance. Also, once you click into one of the ERAs, you also have some more filters here. By hitting this filter button, I maybe only want to see the ones that are matched. Okay, or maybe I want to see only one line at a time. I don't want to see, and this is especially helpful if you've got really huge ERAs. You might want to break it down into more manageable sections. You will get, so now see we see only one line, but it did give us that warning that now your totals are not going to match. So you want to be careful with that too. But just be aware there are additional filters there to kind of help you manage the ERAs a little bit better.
Yeah, and the takeaway here is if you have excessively large ERAs and you're trying to have everything show on the screen at once, you're going to have issues. So to pare it down to workable subgroups within the electronic remittance, you just control the number of lines.
Right. So instead of seeing, I think it defaults, I don't know, it's going to default to show you however many lines are on there. And if you want to break it down, then you can control the number of lines that you see. Okay, open item payments, the open payment open item. Oh, I don't want to be in here anymore. I'm sorry. Let me get that one out of my way. You also have some additional filters up here that I maybe not everybody's aware of this. So if you click on this plus sign, you can now say, I want to see all the details. And I'm going to actually go back to this one because she's got a little bit more activity on her account. So we can say, I want to see details. And if you say yes, it gives you kind of a different view here, which sometimes it makes it easier to look at to kind of match up. So you've got it right under that data service, but it's also a nice way to print this out if you're getting requests from insurance companies or attorneys or things like that that want a billing records. So it's a little bit easier for them to read this. You also can narrow this down by all the filters up here. Maybe you only want to look at a certain date range. You can do from and to. You can do it by which provider, by case, by which insurance, all the nice filters here. Always keep in mind that to change your filters to all in all to see everything, but the filters are really nice to be able to give you a different view and different information on what you could see there. Also, there is this little, let me go back there. There is the little printer icon up here that can give you a quick summary of patient statements by year. So you can filter it by year. You can hide the diagnoses, say okay, and it'll give you a nice little report that will just show you this patient hasn't made any payments, but it'll show you the nice little report that'll show you those patient payments.
And this is used around tax time when your patients are calling going, how much did I spend with you again? So it is pretty quick and easy to figure it out.
Those of you that are using multiple groups, please keep in mind if it's been posted in you have to be in the group the payment was posted in for this to show up. So we found that out the hard way with some of the ladies. The claims tab is in financial, isn't it? So in financial, the claims tab is another way to look at quick claim summary. So this breaks the information down in a little bit of a different view. So instead of just seeing all the open items, you actually see them by claim. And by clicking on any one of these is a quick way to get to your claim summary. Hopefully all of you are familiar with all the information that's contained in the claim summary, but some of the stuff you can also do is rebill it. Clicking your edit can give you a quick snapshot of the information that was contained on the claim. Some of them you can do claim status if the payer that you're using participates with that. And you can also set an inactive date, and we'll go to the inactive in just 1 second here. Any questions on claim summary?
No, let's bring it home. Okay. We're going to be running over, which is totally okay. But I want to make sure we get to the clinical and the rest of it.
The very last thing I have then, and I'll quickly do this, is in our claims work list, anytime that you're in here, you have the ability to sort these by different columns. So by clicking on the plan, you can sort them so you see all the ones with the same plan. Another way to, let's say you wanted to add a note to all of your claims from one payer. The open claims list is a nice way to do that. Let's say we're going to go into these Aetna claims, and we wanted to put a note on every one of these Aetna claims. By clicking right here, select all. We'll select all of them on this list, putting this note here and saving it. It will then put that note on all of those claims. You can do the same thing if you want to rebill, and so then you'll see how it added that note to everybody. Selecting all, you can rebill all of those en masse also. So if you had an EDI problem or something and you need to rebill all of your Aetna claims, it's easy to do that all right here in one place.
Excellent. All right. Thank you, Cheryl, very much. Let's shift.
Okay, sorry about the time.
That's okay. Let's shift gears. And Bradley, if you could take the share. Brad wants to show us just a couple of things. As I mentioned, this could be a 5-hour-long trip, tips and tricks in the EMR. Brad's condensed it down to 5 to 10 minutes of just some of the best takeaways. On clinical today, he's going to show you as well as medical records. Take it away, Bradley.
All right. Can everybody see my screen and hear me okay?
It's looking good. You might want to make it full screen.
I can't control that.
We'll do that
on your. Yeah, you can do that on your end. So just to reiterate what Cheryl was saying about your batch, you want to make sure that you've got the provider in context here because it controls what you actually see in these filters here behind. and it's also nice to have in the login application clinical. And so that'll set these filters, and the provider actually sees what their schedule is today. The next subject I have is print schedule charts and print appointments. So you can select this, and you can actually, in case there's an outage, you can actually print your actual scheduled charts and save it as a PDF either on your local machine, or you can go into administration and actually set this up as a recurring event, so that in the event of a power outage, which no one can predict, or internet outage, you can get those charts, have them ready to go. You can print the appointments. There's a lot of providers who like to actually be able to see their appointments, walk around with a piece of paper in their hand. That's kind of nice. So that's just something there to keep in mind. Any questions on that so far? The clinical today is populated by what's in your schedule. And so bear in mind that what we're put in here is what the provider is going to see here in clinical today. Okay? There's a population management tab, and this allows you to populate your registries. I took a screenshot because we don't want to watch that populate on screen, and this is what it'll return for you. So if you can see in here, I'll blow this up a little bit, you can see that this was for prostate screening. I've got a registry that's been populated, and I configured that in administration clinical tab, and here's your PSA right here. So you can start populating those registries, which is going to become more and more important for meaningful use. The other thing that you want to do in clinical today, so a lot of people love working off their scheduling menu and then pulling the patient into context here and then clicking on medical record, going in, and then creating a chart note this way. And as soon as you do something like that, you are begging for trouble. This we don't want to do. We do not want our health providers to do. We want them to go in from clinical today, and I think Jill's watching this. She knows this when you go in from clinical today, this ties your appointment and the actual patient encounter together, so that I've got a clean billing event. Otherwise, I'm going to have multiple encounters, and it leads to a lot of grief. So when you go in like this and you click on patient goofy this way, and you click on a progress note, or you put in vital signs, you're not going to get that dialog box coming up saying, do you want to create an encounter for today? So in 99% of the cases, you do not want your health providers, MAs, doctors, PAs, creating encounters. I can't stress that too highly. Okay, any questions on that? That will avoid duplicate encounters. On your favorites, so you can create favorites. I've done a lot of that here. Oh, well, that's different narratives. Let me go back to here. So when you're creating favorites for a physician on their labs, you can go into an order or into medications, and you will see in a lot of these places icons to actually manage your favorites for facilities, for diagnoses. And it actually doesn't matter how you get in there. if you click on any one of these stars, you can then navigate around and start setting up your favorites. You can add new, you can sort A to Z, and typically when you're in here, all you have to do is set it to the provider that you want to manage the favorites for, and you can then manage their favorites. Facilities are the same way, and you can add new facilities in case of need. Here, okay. Let's see. What's my next subject? Working with a lab interface. So when you work with a lab interface, that's on the home screen typically. So there's either orders, which we were just doing, or you can go to your home screen here and start working with a lab interface, which is results. You have electronic as well as manual. More and more we're going with electronic, where you actually send your order and receive your results here. And what you can do is then, once you've received this result, and if it's something that you don't want, you can click on this M, matched patient. And if you need to delete this result because you don't want it to show up in the patient's chart, click on non-patient, and then you can click OK, and that's actually going to remove this result. Okay, makes sense? One of the things that you can do as well when you're creating your favorites, and let's get to that, is when you're working with lab interfaces, you want to set up your orders from your lab with their order codes, which is also linked to a LOINC code. A LOINC code is a logical observation identifier and code set. It's a national standard. And when you get your favorites set up, you actually want to search by that LOINC code, so that when I do have my favorites pull in by that facility, I've actually got the right LOINC code linked to that order that the lab uses. And your labs, this is called a compendium, and any lab that you're working with will supply that list. I know that's a lot of information to absorb with you.
The takeaway is just to know that if you're having issues if it feels like working in labs is too difficult, know that you can give us a call, and Cheryl or Brad can look at the way you've got it set up, and it might take a little bit of time to reorganize how you've got your lab set up. That once you've got things tied to LOINC codes, everything works much better. And I think we had a lot of people who ended up with lab results that got tied to the wrong patient through filling out the wrong paperwork or whatever it was, wrong date of birth. And it was, horrifying, the thought that we had this lab result in there and we couldn't get rid of it. What Brad just showed you about assigning it to non-patient gets rid of that problem.
Yeah, and so when you get these favorites here, you want to make sure that that's actually the right LOINC. It's identified by the right LOINC code. All right. The next subject is template versus narrative. So when you're in clinical today, and just as a side note, one of the things I love to do is show providers they can do is they can get to this actions button here with the little down arrow, go to a progress note, takes you right to the progress note. Here you've got a narrative over here. Maybe I won't use Goofy. Let's use Bach instead. I've got Bach here. Let's go to a progress note here. Good. And notice how it says loading over here, and I've got a lot of information that gets pulled from my chart summary, right? So the narrative pulls all this information into my progress note here, so that the provider can sort of look at a chart summary over here and then fill out the today's visit over here. So typically we refer to this side as our narrative and this side as our data side. And you can change how that looks. So for example, I can have this same data side pull up, but totally change how this looks. This is handy for if you want to just send out telephone notes or just a chief complaint, things like that. Pull up different views of the data sets that actually comprise our chart summary. And just to show you that, I have a quick sample of that where, let me go up here because I don't want to click through that and confuse everybody. So here is a completely different view of a chart where, see, I've got, it keeps going, I've got all this summary information, chart information, but I wanted to get a different view of it. I can just have something simple right here.
Yeah, we hear from providers all the time that get records from primary cares that are just kind of giving them everything that it's like it's too much. It's like more information than I want. And when you as a primary care provider are charting the note and you're going to keep the record, you want everything. But if you're sending something out to, say, a specialist, maybe they're only interested in the plan. Well, you can, through the narrative, create different views. So I think that the point there is you don't have to just print everything. If you're providing medical records to insurance companies or other providers, you can control what goes in there by either when you're printing it, selecting the different sections, or by applying a different narrative.
Yeah, and it's a hugely flexible feature. I really like it. Another feature that I like a lot when you're in the progress note, you can either click on Return to Chart Summary and take a look at the summary there, or you can just click on Viewer here, which pops up a chart summary view. You can take a look at breakdowns of that subset, and you can actually work with items in here. You can change status, add diagnosis. So all the feature functionality, editing capabilities that you have in the chart summary view, you also have here. And what's nice is with a hotkey combination, Alt plus Tab on your keyboard, you can flash back and forth between the two like this. And so if providers they want to see, vital signs over a period of time and then flash back to what they were documenting, they can do so. Very handy feature. And I believe is that it? That's it. Now we're into document management. Are there any questions?
The only other thing was deleting a progress note, which
oh yeah, let me take you there. And this also, that ties directly into if you're creating duplicate encounters because you're not using Clinical Today to access your progress note, what you can do is you can go to your progress notes here. You can never delete encounters. It's not possible to delete encounters, but you can delete progress notes that are associated with that encounter. So if you've got people who have created extra encounters and you want to get rid of that so that you don't have those duplicates, you can delete the note here. You've got to select a reason, and then it's going to delete that note for you. If you ever want to see those notes again, not to worry, they just marks them inactive. You can click on inactive and you'll see those, you can see those notes and reactivate them in case of need, that kind of thing.
Excellent. Thank you, Bradley. Okay, we will switch gears to document management. Bruce is going to spend just a second talking about that. I'm going to do reports. We'll slide into administration. Believe it or not, that whole thing is going to take less than 10 minutes, so we're getting close. Hang in there. If you've got something you want to see on reporting, document management, or admin, it's still coming. So take it away, Bruce.
All righty. Click on that. And this. Okay, I'll be quick. Just got a few little things. Oops, sorry, I need to start at the beginning, don't I? Okay, document folders and subtypes. Just a couple quick things. Using folders to group patient documents into logical groups, keep them nice and neat, easy to find, and the subtypes to put uploaded documents into the proper folder and possibly into a chart section. To work on those, to set up your folders and subtypes, it's an admin setup. And here are some from our training company. You can see whether they're global, defined by Caretracker is yes, or defined for this company group would be a no. And so the subtype names are over here. The document type, clinical or financial or patient, not. The folder that it's going to go into once you upload it, and then the Caretracker location, so the chart section. So for instance, dictation that we've defined will go into a documents folder and will go into the progress note part of the chart. When you're uploading, you specify the document type, so clinical, and this subtype is called outside progress notes. It'll tell you where that's going to go. So it'll say, tell you it will go into folder outside documents, and I'll also put it into the progress notes part of your chart. Here's just an example of where it might put that document if it's uploaded into the chart. This is a file that's in the problem list chart section. This patient didn't have anything else in the problem list. Here's a sample document management screen where they've done a nice job of using folders. So it's nice and neat, everything in their respective folders. Also, searching for older files. You might have run into, if you're in PM section and you go into document management and say, I want to see all the files, not just the open files. If you change state to select, it will give you only 6 months worth. So, what we suggest is to use the info button, which you already saw from Cheryl. That'll give you a pop-up. You go to the Documents tab, and it'll show you all the PM documents for that patient. A related hint is when you're uploading a non-patient PM file associated with a patient. So, example for the patient portal, create a patient named, say, patient portal. Upload that file in associated with that patient when you upload it. Or maybe EOB files for your billers. You can create a patient named, say, May 2016 EOB. It's just easier to find those files later on when you go to look for them. So searching for older EHR files, if you go into the document module in the patient's record, you've already seen the screen, it has all the patient's documents, no matter how old they are. So it's not a problem in the EHR. Back to Matt.
All right, thank you very much, Bruce. Okay, so what we've got going on here is back to the dashboard, and we've gone through the patient module, we've gone through all of these. We're going to hit quickly on reports, finish up with admin, and so we're almost there, people. But on reports, what I wanted to talk about was there's a dizzying array of reports here. I like to point people to the month-end reports, and the reason I like to point people to month-end reports is there are these different report definitions, and we can spend time with you helping you understand what those are. But once you've put together the criteria that you want, you can save these and drop them into a report stacker and run them automatically. You can memorize your little tweaks. One thing I wanted to show you is you can take the reports, and let me do a financial detailed report, and maybe we are just going to say, give me everything for the group here. You can start to add grouping and sorting, and you can add more to this existing report. So I could take this report and I could organize it by insurance company and by service provider and by location, and I'd want to sort it by the same thing over here. Oops, let's do that. Service provider. And when you do this, what is going to happen is you're going to actually add data elements to this report that might not have been in the report previously. If I only asked for the financial detail report based on group only, when I print my report, and I'm going to print it in a data file, I'm going to get additional information. So right over here, I've got a report that I did. Had I only run that report based on the group, these fields right here would have all been blank. But because when I ran the report, I asked for insurance company, billing provider, location, and referring provider, I get that additional information in this report. We'll come back a little bit later and show you why that might be useful. But basically in the reports, month-end reports, everything in this section is something that you can totally customize by changing the criteria, which is here, and you can memorize those, save them, and rerun them. Once you start to make these changes, you'll see the reports you're creating have additional names, and it will give the author credit for it right here. So that's a useful tool in terms of being able to manipulate the reporting and save it and sorting. We did have some specific questions about patient balance reports, and specifically the question is, where can I go to find about patient balances? So we're in accounts receivable, or I'm sorry, we're in the financial reports, the month end right now. So we can get like detailed aging. That's going to give us individual patient line items. We can also, using the dynamic section of reports over here, we can get an aging immediately. We can do an aging by, we can do the aging for the entire group, or we can do it for responsible party. And what we're going to get when we do this type of aging is a dynamic report. This is coming off of the current system. It's not looking at the last night's overnight reporting copy, and it's got a nice little feature where if I wanted to work this list, I could bring a patient into context by clicking it here, and then without having to leave the report, I'm able to use my pop-up buttons. So I could literally work AR from here, from this list, without having to change out of it. So those dynamic reports are pretty cool. There's also, if you're working patient balances, there's also the from the home screen, there is this collection module, which if you're actually using that, the information on the screen is something you can work dynamically. And then there is a whole set of reports built in the other reports that deal with all these collection issues. So if you're going to use the collection module, you've got 9 reports in here that you can use to put together to summarize information that you're either sending out to a collection agency or just get some visibility in around your patient collections. We also had questions about referral base. So if we go back to the month-end reports over here, the ones that I like so much, keep in mind that all of these reports, analysis, 13-month roll-up, they have as options referring providers. So once again, you can use your sorting and grouping and ordering and filtering to create reports that will give you information about basically the financial impact of these referring providers, how many patients they sent, what charges, payments, adjustments you had on those, visit numbers, that type of thing. You get there by changing your grouping and ordering and adding filters to it. So the last thing I wanted to show you is with respect to reporting, in spite of the fact that there are a gazillion reports here, and in spite of the fact that the reports that you're going to use you can tweak, I sometimes hear that Caretracker doesn't have the report that I want. So one of the methods that I like to use to get around that is to use some of the extract style reports. And when I say extract, I mean just kind of, it's a report that you wouldn't find the report itself that useful because it's just row after row after row of data, hundreds and hundreds of lines. Examples of that would be if you were to run the financial detail report. You're going to get literally, depending on what you're looking for, if you're just looking for 1 month, you might have a couple of thousand lines. If you run this report for a whole year, you could have tens of thousands of lines. There are other reports that work really well for extracts in the other report. We've created a few. There's a Phasis all detail report. There's actually several places where you get big long lists. So think about the reports that you use, and if you're interested in summarizing those quickly, all you need to do is create any of these reports, and when you're selecting the format for the report, just pick Microsoft Excel data or comma separated value. Those will put those into a spreadsheet type format. So that report I showed you a little bit ago, the detail by insurance company, we ran it right here. When you open that up, you're going to get basically this information right here. It's just line after line after line. And for each line, it's going to have who the insurance company was, the provider, the data service, the patient name, diagnoses, charges, payments, adjustments, even RVUs. When you take that information in this big list, really super cool thing I like to do is turn that into a pivot table. Pivot table is just a really cool way to summarize information and create additional reports. So I could, from my extract report, have literally an unlimited supply of additional reports by simply inserting a pivot table. And when I do that, click and insert a pivot table, I end up over here with this type of a view. And let me just show you how that works. So I'll clear everything. So this right here is nothing more than all the data summarized, and I have the ability now to recreate a report. So if I wanted to know, for example, all my insurance companies and how much we charged out for those, then I could just simply pop in here. I may want to not know the count. I may actually want to know the sum, and perhaps I want the format to be in something a little prettier like that. So when I apply these changes over here, I'm now going to get, instead of counts, I'm going to get total charges in a dollar format. And I can further play with that. So let's say that on top of the insurance, I wanted the location. I can pop that in there. And now you notice how my list over here changed. It's by insurance and then location. Just by moving this location up, I can change the way it looks. I can also make it more of a grid type of a situation. So just think about reports. If you can't find what you want in the list of reports here, number one, shoot us a message. And when you're asking us about a report, do us a favor and tell us what you're going to use the report for. Because oftentimes we're caught up in semantics, and you're saying visit, and I'm thinking encounter, and so I'm in the EMR world and you're talking billing. So if you, when you ask for help on reports, tell us what you're going to use the report for. We're paying our providers and they get a certain amount based on the payments that come in for them. That helps us understand. But just know that you can use the detailed reports and offline, use different offline tools to create some pretty nice, cool looking reports. So that's what I had on reports. Bruce, why don't we take it back to you to kind of close us out on just a real quick discussion on administration, and then we'll talk to you about regulatory issues.
All right. You see my screen? Sorry, I forgot to.
You'll see in mine, but we can.
Yep. I got it.
There we go.
Okay.
Wonderful.
All right. So just doing a quick flyby, 3 minutes administration module. There's a lot in there. So this is a practice tab, administration. So where you can add new operators and make practice letters and that sort of thing. This is the clinical tab, which is EHR related, much smaller. and you can do clinical letters and put your your provider's signatures in, that sort of thing. Setup tab is also practice management related, so PM is obviously much more involved than what the providers do. And here we've got scheduling, various scheduling setup, and contracts, which we're going to talk about really briefly. So contracts, a lot of you may not be familiar with them. We usually set them up for you ahead of time. They determine the financial class, the fee schedule, and possibly the allowed schedule for a charge. So based on the insurance company, the location, whether it's at the office or a hospital location, and which provider. So this one is called UHC Office. So for any United Healthcare charge from the office, it's going to hit this contract. I see office checked over here. And financial class is United Healthcare. The fee schedule is going to use is Phasis office fees, and is an allowed amount schedule in here. Conversely, for a facility, this one is UHC facility. We're going to use a different fee schedule. Again, it's United Healthcare, but in this case, it's going to be one of the other locations. And since we didn't check any box over here, it's going to hit this if it wasn't the office. So it's a quick view of contracts, and you can also choose a specific plan. So if you want a different fee schedule for a specific plan, you would choose the insurance company and the plan, which would show up here. Encounter form maintenance, just really quickly, I think most folks have an ICD-10, a new ICD-10 encounter form. If you go into encounter form maintenance and admin setup, and you see colored icons over here, you know it's a new one, an ICD-10 one. If not, it's an older one and you can't edit it. So if you only have grayed out icons over here and you want a new encounter form, or make changes, you're going to have to create a new one. Along the same lines, editing. Once you go in and edit, it's pretty straightforward. You add in the CPT code here. It shows up on the right. You can change the description. You can drag it, move it around, change the order, make new categories or change the name, etc. And that's that. If you do create a new encounter form, let us know. Especially if it's your default encounter form, we'll need to change that. You might also need to edit appointment types. Here's an appointment that was pointing to this encounter form. If you create a new one, this will keep looking at the old one unless you change this. So back to Matt.
We can't quite hear you, Matt, if you're talking. I can talk about this, though, to start out.
Sorry about that. I was muted. My bad. So quick word about this, and Brad, you absolutely weigh in. Meaningful use in PQRS, probably the bane of everybody's existence the last couple months of 2015 and the first couple months of 2016. Everybody trying to make sure their doctors don't get penalized for not using electronic medical records in a meaningful way, and also not getting penalized for having failed to submit PQRS reporting. Many of you have heard that meaningful use is going to go away, or that you don't have to worry about all this stuff, you're going to get a pass. Kind of true and kind of not. It is kind of going into the background, and it's coming back as, and remember this acronym, MACRA. It's the new payment system for providers. We're all used to this fee for service, and fee for service is going to start diminishing, and fee for quality, or fee for results, or fee for outcomes, fee for reporting, however you want to call it, is going to start to work its way in. So we've got a future webinar dedicated to this. We just wanted to kind of whet your appetite a little bit about knowing that the regulatory changes that are coming will affect your offices financially, and your you can actually earn incentives and get bonused, or if you ignore it, you can end up basically paying for the other guy's bonus by having your Medicare payments get reduced. Would you like to add something to that, Bradley?
No, I mean they're coming up with alternative payment plans and MIPS, which is going to be the two programs that they're going to start to delineate. They're taking suggestions right now, but it's coming.
Yep, it's coming. Meaningful use, the takeaway, meaningful use, not going away. So keep paying attention to it. If you ignore it, it will come back to bite you. All right, so let's just then see, does anybody have any, any final questions? We can wrap this up. We're going to send out the slideshow to anybody provides their email address. We'll also have Brad's and Bruce's slides included in that. We'll have a recording of this on our website. Are there any questions that anybody has that you want us to address before we end the session?
Hi, I have a question about document uploading. The EOBs that we receive through the mail, is there any way for us to attach those to the actual charges, like in the edit screen?
Yes. So, Cheryl, would you like to fire it up? So, yeah, you can have EOBs associated with charges when you're recording it. Now, here's the thing for me. Typically, you're gonna, when you associate them in Caretracker like that, it's kind of a one-to-one. A lot of that happens automatically if you bring it in as an ERA. It's already associated. So I assume, Rachel, you're talking about when you have to scan in a document. Is that right?
Right. When we're manually posting it.
Yeah. So, Cheryl, are you still online?
I am.
So,
and you're going to walk me through this, Matt, because I don't know the answer to her question.
Okay.
About how it could show up with the charge.
Yep. So if it's where I think it is, we'll give Rachel a quick answer. If not, we'll end up having to get back to her. But go ahead and take the share and let's show Caretracker and just go into any document management.
Doc management. I'm in the, well.
So when you're adding a document to document management, you can just click on the add button. This is what we're going to be looking at is what builds the metadata. So when you select a document type of financial and a subtype of EOB, what it will do is take into account the information you fill out now below, which typically we ignore. So if we're assigning it to Betsy Ross and we're going to pick a specific encounter, there we go. Now whatever document I scan in is going to be identified as an EOB. It's going to come up in the EOB section. It's going to be identified as tying itself to that encounter. Now that's great. The problem is EOBs are made up of hundreds of patients. And so there's not a way when you're scanning a document to have that EOB figure out automatically, oh, I need to go to these 100 different patients. However,
okay, so I have a question though, Matt, and I think Rachel, please, I'm sorry for interrupting. So now we've just put a document up here and we've connected it to that EOB. I think what Rachel is asking though is now if we go on Open Item and we go look at that 512 data service, we can't access it from here.
Right. It would still be for document management for that. But what is accessible there is anything that comes in as an ERA. So
yeah, so you can't really access it from that date of service. You would have to go back up to the document management or the info button for that patient, and then you would be able to see, oh look, there it is right there. So if you named it, it still, you know, EOB la 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 data service, it would be easy for you to find it, but it's not going to connect it on that particular data service like the ERAs do.
Now what we've done, what we do, Rachel, just because we understand where you're going with this. I think the scenario is you're on the phone with a patient, you need to get your hands on the EOB quickly. So what we like to do is save all of our EOBs, and you can do it within Caretracker if you want, and we create dummy patients for the month, and we name our document uploads the same as the batch. So when you're in that OI that we were just in, and you were looking at the payment and the EOB wasn't there, what is there is the batch. And so what you can do is you can like do a copy paste. You can do a where you slide across and copy it, paste that into whatever your offline system to navigate quickly to the batch. We do that within Caretracker. So we would go, if we knew we were looking at a patient and we wanted the EOB for May, we've created in that client, we've created a dummy account called May 2016 EOBs. We'd end up going to that. By knowing what the batch is, we could then click on that correspondence, and we kind of get there in a similar way. So Cheryl would be happy to walk you through that offline, Cheryl. You could do a kind of take her into one of our billing clients and show her how we have that organized.
Absolutely.
Cool.
That would be great.
All right, other questions? Thank you for that question, Rachel. I know that Dosha had a question earlier about the colors in the schedule, and I'm thinking we addressed that, but if Dosha is still on the line, maybe let us know if that question, yes, you did. Okay, thank you very much. Any other questions at all? Okay, you may think of questions later, and we welcome you calling, to doing, emailing. Let us know how we can help you. That's what we are here for. So thank you, everybody, for your participation. I know we went long. I think it was due to the content. We just wanted to make sure we covered all that. So everybody have a great day, and we look forward to seeing you on the next Phasis webinar.